Mrs. Jennifer Ndukwe, founder of Smiles Sickle Cell Foundation, an NGO, has said that sickle cell disease is not evil. She said this during the school sensitization program organized to mark World Sickle Cell Day in Abuja. Ndukwe stated that it is just a blood disorder that can be managed. She therefore advised that before getting married, it is important to find out one's genotype and that of their partners.
When you want to get married, make it a point of duty to know your genotype. Make it a point of duty to go for a genotype test. Don't be selfish saying that I'm in love with this person or God will help me. No, you have to be responsible enough to make the decision to marry the person with the right genotype. The right genotype compatibility, if you're AS, marry AA. If you're SS, go for AA. But AS should not marry AS. And SS should not marry SS because the pain is terrible. A lot of people don't even know what sickle cell disease is. If you say sickle cell, some people will just say, okay, it's one. No. Nigerians need to drum up their awareness on sickle cell disease, like the way they did when HIV came. People talk about cancer, but sickle cell disease is as bad as a person can fall ill today and in 2 days' time the person is no more there. Because once the red blood cell sickles, it gets destroyed and it keeps on breaking, destroying the red blood cells. Once the red blood cells are destroyed, the person runs short of blood and the person could die. So it's not a disease that you'll say the doctor will give you a lifespan of maybe you have 6 months to live. No. A person can be healthy today. You had lunch and dinner with the person today, and tomorrow they'll tell you the person is no more because they fell into crisis and didn't get immediate medical attention. We're going to be having an outreach on Saturday. That will be for the public, for everybody, for adults, at our site where we are building our sickle cell clinic. That's at Karu Primary Health Center.
Also speaking at the event, Dr. Mrs. Uzoamaka Ude, a general practitioner, admonished the public on ways to manage sickle cell in their careers.
If a patient already has sickle cell disease, we try as much as possible to manage the symptoms. If a patient comes with difficulty in breathing, you come to the hospital, we'll manage that by helping the patient with intranasal oxygen. If it's a pain crisis, we try as much as possible also to find the cause of the pain. And in doing so, we are able to manage the patient.
The head boy of Cherryfield College, Emmanuel Akuba, said he found the program quite interesting and enlightening as he had learned a lot on sickle cell disease, its prevention and cure.
It's actually interesting and nice because you get to learn about sickle cell disease, its prevention, its cure, and some other factors that actually contributed to it. Because, back in the days where the society and all, we never knew about this sickle cell disease, we find out that majority of children that are brought into the world are suffering from this sickle cell disease. And you're kind of asking, what's going on? Are you for the sake of ignorance, you actually don't know that, okay, it's because of the fact that you married someone that has an S.
Also speaking at the event, the head girl, Cherryfield College, Olajudith Michael, said she could now educate people on sickle cell with the little she has learned from the program, saying prevention is better than cure.
They taught us what causes it and how we can stop it. But here they went further into telling you, they went further to giving us other examples, other signs and symptoms. And earlier I didn't know that babies around 5 months, you won't see it. I thought that when you have it, you're meant to know. But now I know that it's not just there. It comes around from 6 months upwards before the parents get